Did you know that some medications we consume daily might be silently increasing the risk of heart attack? This information is not meant to frighten, but rather as an important precautionary step for our heart health. The heart is a vital organ that pumps blood throughout the body, and its health should not be neglected. Each beat carries oxygen and essential nutrients to our body's cells. When we consume medications without knowing their impact on the heart, we may unknowingly be placing additional burden on this precious organ. Recent medical research has identified several types of medications we need to be cautious about. Before we begin, write in the comments section, do you often consume medications without a doctor's prescription? This could be an important reflection for our health. Let's discuss 5 types of medications that may increase the risk of heart attack, and how we can take appropriate preventive measures. 1. Hormonal contraceptives. Hormonal contraceptives have become an effective choice for many women for family planning. However, behind their benefits, there are cardiovascular risks that need to be known. Combined hormonal contraceptives containing estrogen and progestin come in various forms such as pills, patches, and vaginal rings. Research shows that the use of this type of contraception can increase the risk of arterial thrombotic events, including heart attacks. A comprehensive study involving more than 2 million Danish women aged 15 to 49 years found that users of combined estrogen-progestin pills experienced a 2-fold increased risk for cardiovascular events. This means an additional 1 heart attack per 10,000 women each year. What needs to be watched out for is that non-oral contraceptives even show a higher risk. Vaginal rings, for example, are associated with an increased risk of heart attack up to 3.8 times. This is not a number that can be ignored. Why does this happen? Estrogen in hormonal contraceptives affects blood coagulation pathways, creating a prothrombotic condition. Estrogen can increase the production of blood clotting factors, thereby increasing the likelihood of thrombus or blood clot formation. This effect is especially concerning for women with additional risk factors such as smoking, hypertension, or hyperlipidemia. The combination of these factors can significantly increase the risk of cardiovascular complications. However, there is good news. Contraceptives that only contain progestin, available in the form of pills, injections, implants, or intrauterine devices, generally have a lower cardiovascular risk profile compared to combined contraceptives. The same Danish study showed that progestin-only methods do have a slightly higher risk, but significantly lower compared to contraceptives containing estrogen. Specifically, progestin IUDs did not show an increased risk of heart attack or stroke, making them a safer choice for women concerned about cardiovascular complications. If you use hormonal contraceptives, consult with your doctor about your personal risk. Consider additional risk factors such as age, family health history, and your lifestyle. For women with high cardiovascular risk factors, non-hormonal contraceptive methods such as condoms or copper IUDs may be safer choices. Remember, contraceptive decisions are personal, but should be based on complete information. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen and naproxen, are common choices for relieving pain, reducing inflammation, and lowering fever. Although effective, these medications have been associated with an increased risk of cardiovascular events, including heart attacks and strokes. NSAIDs work by inhibiting the cyclooxygenase, COX, enzyme, specifically COX-1 and COX-2. These enzymes play an important role in the production of prostaglandins, lipid compounds that mediate inflammation and maintain various physiological functions. Inhibition of these enzymes can disrupt the balance between vasoconstriction, narrowing of blood vessels, and vasodilation, widening of blood vessels, as well as platelet aggregation. This imbalance can increase the risk of thrombotic events, especially in individuals with pre-existing cardiovascular conditions. The U.S. Food and Drug Administration, FDA, emphasizes that the risk of heart attack or stroke can occur from the first weeks of NSAID use. This risk may increase with long-term use and higher doses. What needs to be noted is that this risk applies to both over-the-counter and prescription NSAIDs. Many people do not realize that medications easily available at pharmacies can have serious side effects on the heart. Not all NSAIDs carry the same level of cardiovascular risk. Diclofenac, for example, has been associated with a higher risk for major vascular events, including heart attacks, compared to other NSAIDs. Conversely, naproxen appears to have a better cardiovascular risk profile among NSAIDs. This information is important to consider when choosing pain relievers. Given the potential cardiovascular risks, it's important to use NSAIDs wisely. Before starting NSAID therapy, evaluate your cardiovascular history and risk factors. Use the minimum effective dose for the shortest duration needed to address symptoms. Monitor blood pressure regularly and pay attention to signs of heart-related side effects, especially for long-term NSAID users. For patients with high cardiovascular risk, explore alternative pain management strategies that pose lower risks. Physical therapy, hot or cold compresses, and relaxation techniques can often help manage pain without cardiovascular risks. 3. Thiazolidinedione diabetes medications. Rosiglitazone, one of the drugs from the thiazolidinedione group, is designed to improve glycemic control in individuals with type 2 diabetes mellitus by increasing insulin sensitivity. However, concerns about its cardiovascular safety have significantly influenced its use in clinical practice. Rosiglitazone functions as a peroxisome proliferator activated receptor gamma, PPAR gamma, agonist. Activation of PPAR gamma affects the transcription of genes involved in glucose and lipid metabolism, leading to increased insulin sensitivity in peripheral tissues. Although this mechanism effectively lowers blood glucose levels, it also affects fluid balance and lipid profiles, which may have implications for cardiovascular health. This disturbed balance can be a serious problem for diabetics who often already have a higher cardiovascular risk. The cardiovascular safety of rosiglitazone has been the subject of extensive research and debate. A meta-analysis published in the New England Journal of Medicine in 2007 showed a 43% increase in the risk of myocardial infarction among patients using rosiglitazone. Several studies consistently show that rosiglitazone is associated with an increased risk of heart failure. A comprehensive meta-analysis concluded that although there was no significant increase in myocardial infarction or cardiovascular mortality, the risk of heart failure was significantly higher. Observational studies have yielded varied results regarding the relationship between rosiglitazone and stroke or all-cause mortality. Some analyses indicate an increased risk, while others find no statistically significant increase. The controversy surrounding rosiglitazone emphasizes the importance of vigilant post-marketing surveillance and comprehensive evaluation of drug safety profiles. Clinicians should consider the benefits of glycemic control against potential cardiovascular risks when considering thiazolidinediones for diabetes management. Alternative medications with better safety profiles are often preferred, especially in patients with existing cardiovascular disease or high risk factors. Metformin, for example, is considered to have a safer cardiovascular profile and is often the first-line choice for type 2 diabetes management. If you are using rosiglitazone or other diabetes medications, never stop them without consulting your doctor. Sudden changes in diabetes medication can cause dangerous blood glucose fluctuations. Discuss with your doctor about your personal risk profile and ask if there are alternative treatments with better cardiovascular profiles. Regular monitoring of heart health is essential for diabetics, especially those using thiazolidinediones. 4. Certain antidepressants. Tricyclic antidepressants, TCAs, and selective serotonin reuptake inhibitors, SSRIs, are widely used to manage depressive disorders. Although effective, both groups of drugs have been associated with potential cardiovascular side effects that are important to consider when prescribing these medications. Tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, work by inhibiting the reuptake of neurotransmitters such as norepinephrine and serotonin, thus improving mood. However, their pharmacological profile affects various cardiac parameters. TCAs can cause significant drops in blood pressure when standing, causing dizziness and increased risk of falls. This effect is primarily due to their alpha-adrenergic receptor antagonism. These drugs can prolong cardiac conduction, seen in increased PR, QRS, and QT intervals on electrocardiogram, ECG. Such changes can make patients susceptible to arrhythmias, including ventricular tachycardia and fibrillation. TCAs often cause tachycardia due to their anticholinergic effects, which can be problematic especially in patients with pre-existing cardiac conditions. The heart beats faster, which can burden an already vulnerable cardiovascular system. Given these potential side effects, caution is advised when prescribing TCAs for individuals with cardiovascular disease. Alternative treatments may be preferred in this population to avoid unwanted cardiac complications. Selective serotonin reuptake inhibitors, SSRIs, including fluoxetine and sertraline, selectively inhibit the reuptake of serotonin, leading to improved mood. They are generally considered to have a better cardiovascular profile compared to TCAs. However, some SSRIs, particularly citalopram and escitalopram, have been associated with dose-dependent QT interval prolongation, which can increase the risk of a rare but serious arrhythmia known as torsades de pointes. As a result, the FDA recommends limitations on maximum daily doses of citalopram to reduce this risk. Although less common than with TCAs, SSRIs can occasionally cause orthostatic hypotension and bradycardia. These effects are generally mild but require monitoring, especially in patients with pre-existing cardiovascular issues. Overall, SSRIs are often preferred over TCAs for patients with depression who have concomitant cardiovascular disease due to their better side effect profile. However, individual risk factors and potential drug interactions should always be considered. If you are using antidepressants, make sure your doctor knows your heart health history. Regular cardiovascular monitoring may be necessary, especially at the beginning of treatment or after dose adjustments. Never stop antidepressants suddenly without medical supervision. Abrupt discontinuation can cause withdrawal symptoms and potentially worsen mental health conditions. Always work with your healthcare provider to create a safe and effective treatment plan. 5. Pseudoephedrine. Pseudoephedrine, a common decongestant in many over-the-counter cold and allergy medications, is effective for relieving nasal congestion. However, it also has potential cardiovascular effects, especially for those with heart disease. Pseudoephedrine works by stimulating alpha-adrenergic receptors, which causes constriction of blood vessels in the nasal passages. This vasoconstriction reduces swelling and allows easier breathing. However, this effect is not limited to nasal tissues alone. Pseudoephedrine can cause vasoconstriction throughout the body, potentially affecting overall cardiovascular function. Pseudoephedrine can increase blood pressure and heart rate due to its systemic vasoconstrictive properties. Studies show that in patients with controlled hypertension, pseudoephedrine can cause moderate increases in systolic blood pressure. There are reports linking pseudoephedrine use with acute coronary syndrome, such as heart attacks. The sympathomimetic effects of this drug can increase myocardial oxygen demand, potentially triggering cardiac events, especially in vulnerable individuals. Pseudoephedrine can induce arrhythmias, including tachycardia, rapid heartbeat. This effect is particularly concerning in individuals with underlying cardiac conditions or those taking other medications that affect heart rhythm. Individuals with pre-existing cardiovascular conditions, such as hypertension or arrhythmias, should consult with their healthcare provider before using medications containing pseudoephedrine. Alternative treatments with better cardiovascular profiles may be recommended. Even in healthy individuals, it is advisable to monitor blood pressure and heart rate when consuming pseudoephedrine, especially if used in high doses or for extended periods. Significant increases in these parameters are signs to discontinue use and consult with a doctor. Pseudoephedrine can interact with other drugs such as monoamine oxidase inhibitors, MAOIs, and beta blockers, potentially exacerbating cardiovascular effects. Informing healthcare providers about all medications being taken is crucial to avoid adverse interactions. As safer alternatives, especially for those with heart problems, consider saline nasal sprays or humidifiers to relieve nasal congestion. Some newer generation antihistamines can also help allergy symptoms without significant stimulant effects on the cardiovascular system. It's important to note that many cold and flu medications contain pseudoephedrine without consumers' knowledge. Always read labels carefully and choose pseudoephedrine-free formulas if you have cardiovascular concerns. All the medications we have discussed, hormonal contraceptives, NSAIDs, rosiglitazone, certain antidepressants, and pseudoephedrine, have important places in modern medicine. However, as with all medical interventions, they also carry risks that need to be considered. The most important step you can take is to be an informed and proactive patient. Don't hesitate to ask your doctor questions about prescribed medications, including potential effects on your heart health. Always tell your doctor about all medications you are taking, including herbal supplements and over-the-counter drugs. Some drug interactions can increase the risk of cardiovascular complications. For many conditions, there are non-pharmacological alternatives to consider. Lifestyle changes such as healthy diet, regular exercise, stress management, and adequate sleep can often help manage various health conditions with minimal side effects. If you have cardiovascular risk factors such as hypertension, high cholesterol, diabetes, or a family history of heart disease, it's important to have regular heart checkups, especially if you are taking any of the medications we have discussed. Remember, this information is not intended to replace professional medical advice. Any decisions about your treatment should be made in consultation with your healthcare provider, who understands your specific medical history. If you find this information useful, don't forget to click like and share it with friends or family who might be consuming these medications. Simple knowledge can be the key to preventing serious health problems. Write your opinion in the comment section, and make sure to subscribe to the Seniors Insight channel so you don't miss other interesting information. Are there other medications you're concerned about regarding their effects on heart health? Share your experience in the comments section. Thank you for watching until the end. Content like this will continue to be shared on Seniors Insight, so make sure you keep following us for valuable health tips. See you in the next video.